How to write a substance abuse evaluation. Crafting a substance abuse evaluation is a pivotal skill for substance abuse counselors. This comprehensive guide outlines the essential steps and assessments required to effectively assess a client's substance use history and formulate personalized treatment recommendations. Step 1. Begin by establishing a rapport with the client to foster trust and open communication, which are essential for a successful evaluation process. Step 2. Collect comprehensive background information, including personal details, family history, medical history, mental health history, and any legal issues related to substance abuse. Step 3. Utilize validated assessment tools to gather detailed information about the client's substance use history. Use a substance use history questionnaire. Gather data on types of substances used, frequency, duration, patterns of use, and previous attempts to quit. CAGE questionnaire. Screen for problematic alcohol use by assessing 4 key areas: cut down, annoyed, guilty, and eye-opener. DAST-10. Drug abuse screening test. Assess drug abuse severity by evaluating 10 items related to drug use consequences and behaviors. Audit. Alcohol use disorders identification test. Screen for alcohol misuse by assessing alcohol consumption patterns, dependence symptoms, and alcohol-related problems. Step 4. Evaluate the impact of substance use on various aspects of the client's life using standardized assessment tools. ASI. Addiction Severity Index. Assess the severity of substance use disorder and its impact on physical health, mental health, relationships, employment, legal issues, and financial stability. PHQ-9. Patient Health Questionnaire 9. And GAD-7. Generalized Anxiety Disorder 7. Screen for depression and anxiety symptoms, which often co-occur with substance use disorders. Step 5. Screen for co-occurring mental health disorders using validated assessment tools, such as MINI International Neuropsychiatric Interview. Evaluate psychiatric disorders, including depression, anxiety, PTSD, and other comorbidities. Step 6. Identify strengths and resources. Identify the client's strengths, resilience, and available resources using open-ended questions and strength-based assessments. Step 7. Conduct a risk assessment. Assess the client's risk of harm to themselves or others due to substance use, utilizing risk assessment tools such as SAD Person Scale. Evaluate suicide risk factors, including sex, age, depression, previous suicide attempts, and substance abuse. Step 8. Formulate treatment recommendations based on assessment findings. Develop personalized treatment recommendations tailored to the client's needs, utilizing evidence-based practices such as referral to detoxification services, if indicated. Participation in individual counseling, group therapy, or family therapy. Consideration of medication-assisted treatment, MAT, for opioid or alcohol use disorders. Referral to support groups or community resources. Step 9. Ensure confidentiality and adherence to ethical standards by clearly, concisely, and objectively documenting the client's goals, the results of the assessment, and treatment recommendations. Step 10. Go over the substance abuse evaluation with the client to make sure it is accurate and comprehensive. Then, work together to make any necessary revisions and refinements to the treatment plan based on their input and preferences. Conclusion. Conducting a substance abuse evaluation requires a comprehensive understanding of assessment tools, client-centered approaches, and evidence-based practices. By following these step-by-step guidelines and utilizing validated assessments, substance abuse counselors can effectively assess clients and develop tailored treatment plans to support their journey to recovery.